Good afternoon and welcome to the February meeting of the Department of Social Services Board. And I'd like to call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. No one signed up for public comments, so any changes to the agenda, or we would accept a...
Madam Chairman, move approval of the agendas distributed.
Okay, is there a second to that?
Second.
Okay, it's been moved and seconded to adopt the agenda as presented. All those in favor, let it be known by saying aye.
Aye.
And then the next item of business is the minutes to the previous meeting, the January meeting, are in your package. Are there any changes needed to the minutes? If none, do we have a motion to adopt the minutes of the previous meeting?
I'll move to approve.
Okay.
Second.
It's been moved and seconded. All those in favor of adopting the minutes as presented, let it be known by saying aye.
Aye.
Okay. And then on our consent agenda, we have a budget amendment recognizing neighbor-to-neighbor funds from Greenville Utilities in the amount of $4,347. Any questions for staff on that? If not, then we take a motion to adopt the budget amendment as presented.
So move.
All right, is there a second?
Second.
All right, it's been moved and properly seconded. All those in favor of adopting the neighbor-to-neighbor budget amendment, let it be known by saying aye.
Aye.
All right, items for report. It's the Jan Elliott Budget Show.
Along with the Angela Hart budget show. And we have all our staff here who participated in putting together the recommendations, and certainly if you have questions, I may call on them to put a face on some of the things that we're talking about. Hopefully everybody had a chance to review the budget document when it was sent to you. And I will say, for those who didn't hear me, that I do have a copy of the commissioner's report that I did on the annual report last week, I think it was, and it laid, I believe, some of the groundwork for some of the issues that we're currently facing, so it is with your packet. There's also a copy of the revised strategic plan at your place in case you want to check and see how you feel like we're addressing the strategic plan. We do not at this point have our state figures. So we are doing this budget with the understanding that this may all change once we get those figures. Those estimates are not available till February the 15th. So we based it on what was spent or appropriated last year in the state presentation. So our total proposed budget is $325.5 million. And the county share of that, as you can see, is $10.7 million. That represents a 5% increase from the county appropriation last year. And at the bottom of the screen, you can see the exact budget figures. Funds for child care, early education, and Medicaid transportation are no longer part of the local budget as it's being paid directly to the providers by the state. So no longer will the county have to wait 4 to 6 weeks for reimbursement for that $500,000 that monthly would flow out of our budget. And so this means that the county budget for DSS will go from roughly $38 million to about $30 million. So just wanted to point that out. We've talked at length in the past about some of the policy and law changes that are impacting our budget. And they are in your notebook. I'll just hit the titles and that'll help remind everybody. The Federal Program Improvement Plan is clearly impacting our child welfare programs. The NC Fast rollout in child welfare and in other parts of the agency continues. The program integrity folks also are going to start rolling out in NC Fast in the coming fiscal year. Our youth ages 16 to 18 being treated as youth and no longer adults in the criminal court system may have some impact. We have the county assuming full financial liability for any errors in Medicaid benefits or Medicaid claims for ineligible individuals. And just as an example, if we make a mistake in a long-term care case and the person is actually not eligible, that could cost the county $30,000 or more. We also are going to be required to review and respond to any suspicious Medicaid claims or patterns of activity. We are also going to be required to respond to 9 reports that are generated quarterly at a minimum. We also will have Medicaid monitoring beginning of all 100 counties with corrective actions and potential takeovers and all those kinds of things. And obviously House Bill 630, which was in child welfare initially but now impacts the entire agency, puts forward a lot of requirements for us to meet, again with the potential of a takeover. So those are some of the things that have certainly had some impact on where we're going. The factors affecting, you went too fast. The factors affecting our expenses are certainly driven by the growth in demand, the requirements that I just talked about, the staff positions clearly are in response to demand or in child welfare, adult services, and then some of the positions at human services as well as the supervision. We're also seeing demand for increased purchase services, clothing for foster children. We've come up with an idea, Cynthia has worked really hard to develop a potential contract to provide guardianship services so that we don't have to add staff there. So there's some things we're doing that have increased our purchase services. We have moved staff in the past 4 years where we could to accommodate some of our needs, but that does not always work. Right now, we are at a point there's not anybody that we could move to another area. So how much demand growth has occurred? And for perspective, staff has grown by 19% in the last 7 years, from 2010 to 2017. Caseload growth is what you're going to see over the next few slides, and I'm not going to run through it at length. You can look at it. Also, you're seeing Medicaid growth 39%. You're seeing the food stamp growth 90%. You're seeing Medicaid transportation, which is the conversation to authorize the reviews, those kinds of things, and actually scheduling has grown by 125%. I did move a staff person there about fiscal year 2015 from another area in the agency, and that has helped some. Crisis assistance has grown by 13%. Part of that's, it would have grown more, and that 2016 was a year that we had a little more money, and GUC did some computer changeovers which impacted the numbers of folks that came in to see us. But payments overall have declined. And one of the things that's an interesting dynamic is because we've had less money, denials and folks have come in, denials have increased over 600% in the last 4 years. So we are seeing lots of folks, but we're not able to approve a lot of folks. We had, and Michelle updated this for me before she came over, we had 100 folks at the Human Services Center this morning by 12 o'clock to do crisis applications. So the demand continues. And we are currently at, as of today, this morning, we were at $52,629 left in that program. So that has some impact. For our CPS reports and then corresponding work from there, you're seeing an 84% growth. In child support, you've seen an 8% growth. In foster care, an 82% growth. And by the end of January, and 102% in, we're at APS too fast, but by the end of January, we had 204 children in care. So we've added children since the end of December. We also, and this does not reflect the 19 children 18 to 21 that are in that new VPA voluntary placement that we work with after they finish school or whatever to help them transition to adult. We do have we had 2 part-time FTEs helping with visitation. We have added the Vanguard temps now. So, and we've had turnover in this area. Now to APS. There, our reports have grown by 79%, and the reports requiring investigation have grown by 102%. We did adjust some things a year or 2 ago and have added someone to help there. Again, we've had some vacancies, but this is tremendous growth. Similar with guardianship, a 56% growth, and see how that's just been in the last 3 years. So again, continuing to grow. And these years vary because that's what I could lay my hands on at a moment in time. So we didn't go back and research if I didn't have that in prior information. So that's the demand that we're seeing. And it's not that we're out on the street requesting people to come in the door. Okay, so what are the positions that we're asking for? In child placement, which would be foster care, we're asking for 3 social work, 3 positions. And again, remember they had the 82% increase since 2013 and the 18 to 21-year-olds. We have a regulatory standard of one worker to 16 children. We currently are running something in the 1 to 22 ratio, and we have pulled in staff from other parts of foster care, like our links folks, our licensing folks, et cetera, to help cover some of that and still have that kind of ratio for the pure foster care caseload.
Jen, can I ask a question, or a week-old question?
Sure. You can ask a question.
When we talk about ratios, caseload ratios, like 1 to 16 and 1 to 22, other than the obvious in terms of the increased demands, how does the state view that in terms of, I mean, it's a recommendation?
It is a standard that we are supposed to meet.
Okay.
And if we're not meeting that if we can meet that standard and have wonderful outcomes, they probably would not come and cause us problems. But if we are having difficulty in meeting our outcomes over the long haul and we are not meeting those standards, one of the things that they would do if they decided to move forward with us and say, you know, you're not doing what you need to and we want to get into corrective action, they would be recommending increased staffing.
I have a question as it relates to those children of people who are homeless. Do you have any way of tracking them or keeping up with them, and where would they fit into this?
We would not be involved with homeless children just because they're homeless. If we get a protective services referral, which would not necessarily be because they're homeless, but if we got a protective services referral, then they would be in the child protection arena where we would investigate, assess, put services in place or whatever. We might also see these children in some of our crisis programs where we might help a family, pay some rent or refer them over to the shelter where we have a contract and they're doing some of that. We might help with other kinds of things. But we don't have anybody at this point in time who would work with those individuals. And we would not be providing services.
That's what I thought about, because I don't know that the child was homeless or not, but exposure to the elements and that sort of thing. And I'm bothered about the fact that I wouldn't ask, but because you see, and what you see may not be the case, and then if you're told, then you feel like you're gonna have to do something, so I just look. But there is a concern there as it relates to those children. And if you have no way of knowing, then I would hate to see something really happens to them.
Right. Well, certainly if anybody would want to make a report based on information they have where they believe a child is not being properly cared for, we would see we would look at it, investigate it, assess it, see what services we could put in place. And I know a significant number of the shelter folks are families with children. They have a whole wing, kind of.
Yeah.
They have four, I guess they're family areas.
Right.
But don't they still have to get out every day? That's the part that bothers me, is that the policy forces the people, and if they're not children who are school age,
Right.
then, and they have to get out in the elements. That is the part that concerns me, and that's my hesitancy. But if this county cannot provide something for them, then where does it lie?
You know, it's one of those troublesome situations, and certainly we can talk about that, maybe in a different venue.
Okay.
Okay.
Okay, all right.
Okay. So we do struggle, obviously, as you can understand. We are gonna be implementing NC Fast. That's gonna have an impact. The children have very severe problems today. Staff turnover's been high. If you look at our strategic plan, we believe that these positions meet goal 1, improve child safety and permanency with full implementation of visitation plans, permanency roundtables, and those kinds of things. Staff would have to have the time to do what needs to be done, and in the long run could potentially reduce the number of children that we are serving in care if we did this. So we're saying one of these workers would work with the 18 to 21-year-olds, and the other 2 workers would work with our regular foster care caseload. The social work supervisor 3 would be for child placement, also the foster care unit. Frontline supervision is just critical to quality service delivery, and when you have higher staff turnover, you need to do some additional coaching and mentoring. There's accountability, and these are the folks who are going to make sure that happens. And staff exit conferences in all areas of child welfare have indicated the need for more supervisory support. The liability without good supervisory support is there also. If you look at the strategic plan, again, Goal 5C and Goal 6A speak to staff training, reviewing practice, enhancing quality, and reorganizing foster care licensing, which all of this would help us with, because right now we do not meet the standards. Moving to child placement and protection, we are recommending a staff development specialist. We believe that for the program improvement plan, the push that is there, the fact that we have got to implement NC Fast, we've got other technology training that needs to go on, we've got to troubleshoot the NC Fast problems, and there will be those problems. There have been everywhere else. And unfortunately, the folks over at the Human Services Center have more than they can do now with that particular area, so we would have to get somebody over here to do that. They could provide policy training in response to regulatory changes, remedial training. They could make sure that all the staff get their required 24 hours annually. Again, provide more consistency, and this addresses strategic plan goal 5, which is improve the agency staff development program by developing and implementing staff training in all divisions. So that would be that one. We're asking for 2 social workers in child protection to help reduce. We believe that prevention services, these folks would not be they would not do CPS assessments. They would not do in-home services. These are folks that would, again, sort of a little bit about what Commissioner Perkins-Williams is talking about. They would work with folks who don't quite fit the Child Protective Services baseline. And it could help us a lot with folks that we work with maybe in-home services or work with in a CPS assessment, but don't quite rise to the level. And then we close the case and they turn right around and come back in. And some of these folks need longer term support than that brief work that we're able to do provides for them. So again, this impacts strategic plan goal 1, improve safety and support for children. to ensure they're not repeat victims. And House Bill 630 and the federal reviewers are all looking at repeat maltreatment as one of the indicators we've got to meet. All right, so moving into IA&T, which is our investigation and treatment group, assessment and treatment group. Again, they've seen an increase in reports. They also get reports from other counties they have to follow up on because maybe part of the family is in Pitt County. So we've seen that. The standard is 1 staff to 10 cases. We're currently at 1 to 20 or more. And the regulatory maximum for closing a case is we're supposed to close within 45 days. Pitt County currently is averaging 71 days to closure. We've had a 41% turnover in 2017 in this particular area. You know, it's just been tremendous. We did move one position that when somebody left, we were able to move one position into supervision. This was not approved in last year's budget. We were able to do some work, and about mid-year, we're able to add a 4th supervisor in child protection, which we think is critical based on the standards there. But we still need some staff.
These people are in this
Yes, ma'am.
building.
Everything we've talked about is in this building. Okay? So those are the 9 positions in child protection and placement. Then we could move to adult services. Adult services is asking for a social worker, kind of like those 2 social workers we talked about in CPS. They can go in and do the investigation, the assessment. They can put services in place, but they don't always know that those services are going to take. But they have a time standard by which they have to move forward, and we, at this point, are not meeting some of those standards. So case closure is one of the standards we're not meeting. We are in corrective action for that right now, and the new House Bill 630 is moving the standard from 70%, which we're not meeting, to 95%, which is going to be much worse, harder for us to meet. Strategic Plan Goal 2 is assist vulnerable adults with accessing all available services. This person could also perhaps reduce the numbers of folks going to guardianship, because from time to time folks get moved to guardianship because we know then that they're going to get that ongoing support that they need. When, you know, maybe if we stayed with it a little longer and made sure the fix worked that we put in place, we might not have to move to guardianship. So, now moving to the Human Services Center, we're asking for 4 quality control, income maintenance, 3 positions. They would be added to our current quality control staff. This would allow us to double the number of check cases. It would allow us to focus on those high dollar cases in Medicaid, because this is going to be focused on Medicaid. And still maintain some of that new employee checking, which is critical for Medicaid and for food stamps too. This gives you some additional work because the supervisors with 16 to 18 people to manage are limited in how much checking they can do. So the importance here is this is a Medicaid-funded group of folk, and as you remember, in Medicaid now, we are responsible for any paybacks for errors. So this would give us another opportunity to try and make sure that we were getting ahead of the game on that. Also, we've asked for 2 Medicaid verification specialists, which are income maintenance workers too. They would work all those state match reports. They would follow up on all those suspicious claims. We have 5 days to respond to the suspicious claims reports from NC Track. So you get it, you got to do the research, you got to make the decisions, you got to get it back. Don't have a clue what that volume is going to look like. We do know, though, on the match reports, there are 9 of them, and looking at every person who shows up on a match report for income, earned or unearned income, which is everybody we serve just about, that's going to be a tremendous report to work once a quarter. And so to make sure that gets worked and we don't miss something, and that's just one of the 9 reports. If they do have any downtime, they could work, you know, with vacant caseloads or something and help out from that standpoint. I don't anticipate a lot of downtime. Again, this is a 25% county dollar because Medicaid, it's a Medicaid-funded service. We'd be working Medicaid reports to support Medicaid. We have high caseloads compared to a lot of counties, especially in the review area. And our staff, as you know, are measured on timeliness and accuracy. And so working extra reports and things with the regular staff might not happen. Moving right along, because I'm trying to get us through here. The program integrity supervisor that we're requesting right now, we have a staff of 3 doing program integrity. They will be moving into NC fast this year. We have a mandate to process food stamp cases within 180 days of the referral, and we have finally met that standard this year, and we are thrilled. But we're not doing as much work in other programs, and again, if we can get it, if we see things in Medicaid and refer them over, then there is the potential we can get that money paid back or start working that claim. Increased collections, we do get reimbursement, a percentage of what we collect, as you can see. We're holding clients accountable by doing this. Right now, we have a senior worker who is trying to take the role of supervisor, et cetera, but that takes away from her ability to process cases, and she really doesn't have authority. Now, her supervisor is Thomas Knight, who was responsibility for everything at the front desk, all the QC folk. I mean, he has a broad range of responsibilities, and so this would give somebody to focus on this. The Medicaid supervisor for Outpost, right now we have a program manager type person who supervises about 46 individuals in intake. She has 2 supervisors that help her. But she also directly supervises all the staff that we have at Vidant, at ECU physicians, and that is a contract, and those positions are paid for by Vidant and ECU physicians. We don't have to pay for those. And so we, you know, whoever this person, if we could get this position, could focus on that. Again, these are going to be Medicaid dollars because these people are coming out of the hospital. So they've had a procedure that probably was costly. We could work with our contracting agencies better on site. We don't want to lose those contracts because we'd still have to do the work for those cases, and the county would be paying the 25%. We would add work first to this just because that's a couple extra folks, and so for that reason I can't make it a full Medicaid position. The county share would come from MOE, so you're already having to keep that anyway. So this would free up the current program manager to literally manage intake, and it's important that we get intake right because that leads the direction for the rest of the time that case is in the agency. So, an intake specialist, the intake program manager has requested another intake worker. It's an income maintenance caseworker too. Again, we processed probably over 1,000 cases last month for food stamps, Medicaid, and Work First. If we could continue to do well in this area, we're meeting timeliness and accuracy. We need to do it right the first time. Consequences for failing are critical. It's a client service issue, and we get a lot of calls, as many of you know who have been here for a long time, about when am I going to get my money, when am I going to get approved, when am I going to get my Medicaid card. Those calls slow people down and also give us bad feedback because we don't always call those folks back like we should. So, now, we are putting in, as we have probably every year, the deputy sheriff for the Human Services Center. Back 4 years ago, just before I got here, there was a deputy to provide security in the Human Services Center and one for over here. Due to budgeting and needing for positions and whatever, those positions went away. We do contract during high traffic periods, like right now with some of the energy stuff going on, about 3 to 4 weeks at various points during the year. It would add up to about that. They're on call if needed. We occasionally have issues that we have to call law enforcement. And then there's some issues we resolve ourselves. Some staff are fearful because they hear folks curse and scream and yell and threaten. Our staff are behind locked doors. You know, you have to be escorted, that kind of thing. In the last month or so, during some of the large numbers of folks with crisis, there was a discussion with the Deputy Mealy from the Sheriff's Department and Mr. Elliott about the need for full-time staff over there, and I agreed to put this in the budget for the coming year, in the request. So we have included that deputy in the 10 positions for economic support services. So other significant non-personnel budget increases. We presented to the county in the capital expense line $200,000 to replace vehicles, which we would get reimbursed for. And if the capital improvement line was approved by the commissioners during the budget process, we would reduce significantly our maintenance costs for vehicles, because right now we're doing things like replacing transmissions and stuff. This would mean that what we would be paying for are the routine maintenance like oil changes, rotating tires, so that would reduce it significantly. So although we've got $200,000 up here, that's gonna be some trade-off if that is approved when the budget is done. We are getting more and more court-ordered psychological testing. We're getting, because of the huge increase in foster care, clothing for children, those kinds of things is just continuing to grow. We're having similar kinds of things with our adults in the APS area and some of our guardianship adults because they don't have income to meet all their needs and their placements, etc. Cynthia has done really well. She's had a meeting with a guardianship services company, and she can talk about that if y'all want to. In fact, they have met with her and with the clerk of court to talk about could they take on some of our guardianship cases. Again, that's growing like crazy. And so we have put in money to start that process this year. It's $275 per month per guardianship case. If we grow it, they will reduce the cost, because right now the furthest east they are, I believe, is Raleigh. Right, Cynthia? Correct. And then we want to begin the implementation of signs of safety, which again we believe would have some impact on our foster care caseload and begin to reduce that, although it will take some time for that to happen. So there are lots of smaller things in there. For example, we are having to now starting to do fingerprints for all of our child support folks. And those dollars can be anywhere from $38 and up, depending on who gets the contract. Enhanced background checks for agents. We're having to pay for the work number. I mean, so there are lots of little postages going up, so there are lots of little increases in here. So that is our budget presentation for this year, and I now see what questions folks have, and comments, and et cetera.
So grim, you don't know where to start because the needs have increased.
And how does this compare to last year in terms of the number of positions that you requested?
We requested probably 5 or 6 positions last year, got, I think, 3 funded last
Okay.
year.
All right.
We have requested, the first year I was here, the interim director had asked for 32 positions, something like that, and got 31, I think it was.
Wow.
And that was catch-up because during the budget freezes and all those things, as positions were vacated, positions went away. And so this kind of got you back to about where you were. Most of those positions were in economic services, and it was reflective of the NC FAST problems and those kinds of things. Since then, it's been 4, 5, 6 positions a year, and we would get a couple of those, 2 to 3.
And then we still got the rollout for the new arm of, I call it NC FAST, the Medicaid stuff. And there's gonna be problems. There's gonna need some workaround, some worms, some bugs. And honest to goodness, that's, you know, that NC FAST was a real gamut of problems. And I don't think with this new thing coming in, that it's gonna be any better. What do you think?
It's gonna be a different situation because we're talking about going out in the field and doing safety assessments, doing child welfare plans, doing intakes. It's gonna look different than what we're doing with economic services. We have already been postponed twice because the state has agreed to make it right. It is not, it's going to have bugs for a while. There's no way around it, and they're working to fix some, but it's going to.
Here's what I wanted to say. Not all places are equal in the county. You're not gonna be able to do that on certain computers in certain areas of the county. Because if you cannot get the internet or, the access that will make the machines that you have in your hand work, you are at a disadvantage to begin with. And whenever I go at certain areas and you don't have phone and you try to pick up another tool and it's not working, then you need to drive on and get somewhere else. That's gonna hurt your worker.
Well, and right now,
Productivity.
The counties that are trying it right now have indicated that productivity has gone down. Part of that, they believe, is learning curve. Part of that is working through some of the bugs. Part of that is just the NC Fast and the way it operates. Right now, the only mobile solution they are planning for is investigations. They will be doing foster care and in-home services much further down the road. So only the investigators would be using the mobile apps. And for us, that's going backwards. So.
And see, you won't know until you really get started.
No.
That's the real fear.
And there's 5 counties right now.
Mr. Manager?
I was
Would you
looking
like-
at him,
well,
and
I'm-
I don't know why he was looking down.
Well, as a reference point for Dr. Bunch, can you speak to positions in the overall county budget and what the last couple of years have looked like in terms of requests versus what you were able to fund?
I mean, coming out of the recession, the last 3 or 4 years, it's been, we've had growth in the overall tax base, and we've been able to accommodate the PEP increases, the performance increases for employees. We've been able to accommodate some cost of living increases. We've been able to expand the budget marginally with new positions, but not as departments have requested. We're really seeing, as we move into the new year, being fiscal year 18-19, as being, again, there's growth there, but there's not growth to do the kind of expansion Mrs. Elliott is requesting here. Not that I have all that in front of me yet. We're in the process right now of compiling all of the expenditure requests from all the departments and then comparing that against their revenue. So until I have those 2 buckets matched and see how far out of balance we are or we're not, I might be speaking ahead of myself. But I think for the most part, I've told departments not to look for too much expansion in this budget, just because there won't be. And this is an election year, and also last year the commissioners did raise taxes a penny. So those factors being put on the table, we know that more than likely we will not see a tax increase this coming year. But next meeting, we should be able to report back some more definitive as we move towards the Board of Commissioners budget workshops, what we'll be recommending.
Okay, thank you.
Doesn't sound real good, does it?
Other questions? Any comments, Jan, Angela?
No, I mean, I certainly understand all of what Mr. Elliott just said. I also understand I need to do what I need to do, and we will work however we need to work. What we do need for this board is to transmit the budget. I don't know that and certainly the commissioners will ask, well, did your board approve it or whatever, or support it? But basically, it is, you are transmitting the budget to the county for them to work.
So then, do we have a motion to take this budget package forward, because it's due to the county manager Thursday at 5 o'clock?
Right. Which is why we moved everything up.
And as a side note, we do ask departments to document what their needs are even if we can't meet them, so they're documented, so the following year, or if accommodations are made in the process of the budget going forward in the spring, that they can be seen and realized. So yes, we do ask them to state what their needs are. So Mrs. Elliott has done exactly what you've hired her to do and what she should do.
And certainly we cut some, we did not ask for everything everybody asked for, so.
So when it does come to positions, Jan, and, you know, the number you've requested, and if they're not all granted, do you prioritize those, or do you have the opportunity to do that?
Yes.
He will ask her
He
to.
will ask that question.
Absolutely.
Okay.
And I
If he
have
were-
already asked them to
Okay.
help me
If
make
he
that
were to come
decision.
back and say, if you could have 7, what would be the top, that
Right.
choice becomes hers.
Well, I kind of like the budget because you have to ask for what you need, and then you have to pretty much look at the preventive end, because a lot of this has prevention to reduce recidivism and to provide that safety net, reduce errors, and that type of thing. And so, go for it.
So there's
Is
a
that a
motion.
motion? I'll
I
second
move,
it.
I move that we push this budget forward.
All those in favor of pushing it forward, let it be known by saying aye.
Aye.
Okay, so now it's on to,
Jim was the second, right?
That was-
Right. Yeah, Susan was asking that. So-
I didn't do any of it.
You have to be careful.
so now on to the director's
support it.
report.
Okay.
Really
want you
quickly,
nuts.
so we,
We'll make it fast. The agency personnel, we continue to have vacancies. A lot of these vacancies continue to be because people are being promoted and moving around and retiring and whatever, although some are people who are leaving us, as you saw by that turnover rate.
I want to ask you a question. Do you do exit interview, and what's the morale of your staff? Because I'm always concerned you get good quality work if they're happy, or maybe not happy, but content.
Right.
Maybe.
Well, you know, the county does exit interviews for all the staff who leave. A lot of supervisors do exit conferences, or managers do exit conferences. I all get feedback from various places. Because I'm not always here, I can't always manage an exit conference. What we do know is that in our child welfare area, probably more than anywhere else, with adult services coming slightly behind it, and Cynthia can speak up or not, that because of the caseload sizes and the demands being put on them, and the inability of supervisors to do all the work that needs to be done to support the staff, we are seeing folks leaving because they are not happy. And they cite in part supervisory support, or the lack thereof. That is not across the board, but that is a fairly common comment.
So these position does ease that, hopefully.
So these positions would ease that, and it would, you know, and we're doing some work internally to help supervisors be able to better support their staff. But I would say caseload, I mean, people are out in this agency till 7, 8 o'clock at night.
Yeah.
They work extremely hard, and in the other building, I know, you know, Michelle's folks in crisis have been working till 7, 8 o'clock and weekends, just trying to process what they take during the day. So folks are tired, and it shows. It shows. I mean, that's all I can say. Okay, so that's what if anybody's got any questions, that's what's going on from that standpoint. We got your timeliness processing report. We missed it last month because it didn't come in time. So you have last month and this month on the chart. We made 90%. 90% is passing. We said Yahoo because we were really fearful with the snow, particularly that day we did not open at all. Anything that came due that day was overdue. So we were fortunate. 20 counties failed in North Carolina for January, and the month before only 6 did. So this was a huge impact, the weather. So our folks, I'm so proud. Energy, you've got your energy report. I sort of touched on a little bit with the crisis, which this is a little bit older information, but this shows you kind of what's happened through through the early part of February, the end of January. Everybody's working hard. The county objectives report, I don't know, it's the quarterly report. I don't know if anybody had any questions. Hopefully you looked at it. I can certainly answer any questions. I don't know that you want to take the time to run through it unless somebody saw something
I
really
thought
that
these,
stood
I
out.
thought these numbers were high.
On the crisis,
Yes.
in what way? The numbers of households we approved compared to denied?
I thought it was high. But
Well, and you know, if folks came in with a cutoff notice, because you have to have a cutoff notice for crisis. If folks came in with a cutoff notice and the temperature was below 30 for, I think it's 4 days, below 45, then they could pretty much get assistance. If the temperatures were staying above that number, then even with the cutoff notice, unless they had a medical need or an infant, we weren't going to approve them.
30 is cold.
30 is called 45 is what she said. 45. So that's part of it. Part of it is folks have already gotten their $600, and that's all you can get in a 12-month period of time. So. Okay, so that's pretty much it. I will say, and I don't know if anybody had any questions about my report I sent y'all, the director's report I sent you offline. As far as upcoming events, I'll hit that and then y'all can do what you need to do. The child welfare convening that Ms. Perkins Williams was going to got postponed due to the weather to the 28th, so there'll be 5 of us going to that. Social Work Month is in March, and didn't know if anybody wanted to, how the board might want to participate in that, or if they did in any way. You can let us know. There is going to be a DSS Agency Expo on March 20th at the Cooperative Extension. Y'all participated in the last one by having a table, and you all staffed your table and talked about what you did and met staff, so if you want to do that again. This year, we are asking a small number of outside agencies to also participate with us and talk about some of the services they provide.
That's good.
Because folks at different places in the agency come in contact with people and need to know where to refer people appropriately. Now, it's not going to be every group, but we'll have got 5 or 6 that are going to come. So certainly let me know if y'all want to participate in that, and I'll set you up a table.
Do we want to do that, Madam Chairman? Do we want to participate in the DSS workshop?
The agency expo again, like you did last
Yes,
time.
Do we
absolutely.
really want, I think we need to make that
Absolutely, we
decision right
will.
now,
We
so I
won't-
can plan it right.
Okay,
No, we
The-
want to be there so staff can see us,
right.
talk
We-
to us.
And what time is
It's
that?
9 to 11.
Okay.
You can come in at 8 if you want to set up. The building will be open at 8. I will
March
have
the,
March the 20th. I will have a board, and I think last time I presented sort of the role of the board and stuck it on the display board for you. But if y'all want to do anything else, you can
And we
get in
just
early.
sort of sat there and talked to the staff, and we rotated. We didn't all stay all day, but we kept a couple of us at the table all morning.
So and it was a fun time. We will be trying to have some type of a little contest. I'm thinking scavenger hunt, where folks can be asked some specific questions to find out from each of the different tables. And then if you get them all right, you go in a pot and we'll try and do a few prizes. So
well, that makes it fun.
makes it fun and it forces
incentive and
folks
rewarding.
to go do.
And is this part of the activities for Social Work Month?
No, this is
Okay.
separate apart from that. This
Okay.
is just for the agency as a whole. It's our regular staff meeting month.
Okay.
And so we're gonna do this in lieu of a staff meeting.
So will you send us
I
those
will send you
activities?
some information
Okay.
and stuff. Now, the other thing, for, Child Abuse Prevention Month is in April, and Elder Abuse Prevention Month is in June, so there will be things going on around those kinds of activities, and we'll keep you informed.
Do we run anything on the, GOTV relating to those months?
We will.
I
That's part of
I
our
think that's a good
communication
idea.
plan this year.
I think that'll be a good idea.
You have, everybody has the annual report. There are spare copies down there if you want to take any to anybody, and I have more in my office. I just brought a couple of handfuls up there. So, that's going on now. That's all I have to say.
Comments from members of the board. Oh, and let's put it in the record. Becky is still recovering from her knee replacement, and that is why she's not here today. she has found that knee replacement was not as easy to manage as she had expected it to be. In fact, I think she referred to it as she was finally back from the dead the first day she talked to me, because she had been just in such incredible pain.
That's what she was saying to me too.
So, but that's why she's not here. Any,
I don't,
Mary?
Oh, I have no remarks. I just think that, under the circumstances with weather and the push for services, I think the staff really should be commended on
Absolutely.
their, productivity.
Meeting and exceeding the challenges
Yes.
every day.
Right.
Dr. Bunch?
It's not easy.
No, no, it's not. Nope.
No remarks.
Anything else you need from us?
Yeah.
Then otherwise, our next meeting is March 13th in this room, and we would look for a motion to adjourn.
I move to adjourn.
and I'll second.
All those in favor?
Aye.
And now Public Health may have the room.
That's right.